Hi, Dr. Pappas here. I'm sitting with Heather and Jason, and we're going to talk about chiropractic care. And you two, how long have you been married now?
It'll be 3 years in May.
3 years. It seems like just yesterday.
Yeah.
And we just got done talking about hunting. They're hunters. They like to hunt, and we talked about this is deer season weekend coming out of it, and we're just talking about their experience. Jason's mom just got one. My son got one, and we didn't get anything. So. But you went hog hunting here not too long ago, right?
Yes.
Bow hunting,
Yes.
and you got one, didn't you?
I did.
Tell me about that. How exciting was that?
It was pretty exciting. I mean, it was hardly even daylight. What was it, like within first?
It took 20 minutes.
Yeah.
Yeah, and she had one down. She was the only one that killed one that day, as a matter of fact. Right?
It was, yeah, it was the only one.
Yeah, the only one that killed one that day.
Awesome.
Yeah.
Good deal. Okay, back to chiropractic. Okay. Oh, now Heather, you've been seeing me for a while, and then but I know that you've gone to chiropractors in the past as well, right? Prior to seeing me.
I have not actually. You're the
Oh,
first. You're my first.
Okay. I thought for some reason it probably didn't take you 3 years to come see me. Then.
I didn't have back pain 3 years
Okay.
ago.
All right. I want to briefly just kind of talk to me about Heather, since you've been seeing me longer. What brought you into the office? And do you remember originally?
I don't know. I've had back pain like for as long as I can remember. I don't know. I guess just with what I do, like I'm a nurse, or I was a nurse at the time. I'm a nurse practitioner now, but at the time I just was having pain a lot at work and just kind of over it. So when I saw your $20 patient, like new patient special
Yes.
on Facebook, and I thought, why not?
Sure.
So 20 bucks, all I had to lose. So.
Heather's a nurse practitioner, and it is, what department are you in?
In the emergency department.
Okay, so yeah, you got to be on target all the time like that.
Right.
And stressful job sometimes?
Yeah, absolutely.
Okay. Would you consider chiropractic to help with that aspect of it?
Yeah, I think so. Like prior to chiropractic care, I felt like I had a lot of back pain and headaches too, and I've noticed since I've been coming here that I have less headaches, which is I didn't realize would really go together, but I think they do. So.
No, they definitely do. We get a lot of. I pride myself on. I used to run a special for migraines specifically. It does help with tension headaches, migraine headaches, and a lot of different type of what they call cervicogenic, coming from the neck, headaches that deal with the suboccipital muscles and things like that. Not to get boring, but yes, chiropractic definitely does help with headaches. And then Jason, tell me about what brought you here besides Heather telling you to come here.
I started having back pain probably about a year ago, maybe a little bit lower back pain. So working EMS, lifting patients in bags, and even just working out ended up started to be a real chore.
Gotcha.
Even just bending down to do things, and so I started telling her about it, and she was like, why don't you go to the chiropractor? And so I was like, well, next time you do the $20 special, that same day you put it on. And so that's what made me start coming, and yeah, it's helped me out a lot.
Good deal. This is cool. We run a $20 special occasionally, and it's on Facebook, and I'm going to put this video on Facebook too. So and a lot of people have probably seen it. It allows a person, kind of removes a little bit of the financial variable on the upfront end of seeing if chiropractic can help. We do x-rays, exam, things like that, and here's two people that took advantage of it. And so I didn't think about this, we have lifesavers. We have an ER nurse and a firefighter, right? Mm-hmm. So these people here, they need to be sharp, they need to be moving and hopping, and they can't let little pains and things like that get in the way of their life. So great opportunity for what I do to potentially help them, so they can, knock on wood, maybe help me in the future too. Or let's hope it doesn't happen. But that'd be nice to know that you're all there to help others as well. Anything about chiropractic? Let's say if you knew of someone, family member, friend, or anything like that, who was thinking about going to a chiropractor, why would you tell them to come see me at this office?
I don't know. I love the staff here. They're all super friendly. I love that I can just like call and be like, hey, can you fit me in today? And I've never had anybody tell me no. They're always like, yep, come on over. I'm like, I'm 5 minutes away. They're like, all right. And I walk in and I walk out, and it's nice.
Good.
It's just super quick, and everybody's really nice.
Yeah, that's it. That's
Yeah.
the same thing. Yeah, absolutely.
The office flows. We take into account walk-ins and call-ins, and there's been times where people I know, they say, I was gonna pull in the parking lot, but it was packed. And they were afraid that, like they pull in, they're thinking they're gonna have to wait a half hour or something like that. But you'll find that, even though there's a lot of people here, we do a lot to try to keep it flowing, where a person may need a therapy first or then the adjustment. So even though the office may seem busy, the wait time is not that big at all.
I don't think I've
Nothing.
ever waited
No,
maybe
more than a
5
couple
minutes
minutes,
at
yeah,
the most
that's it.
ever, and that's like a bad day.
And you may see us run around with chickens with their head cut off,
Right.
but
Yeah.
well, we're trying to be fast so the office wait isn't long. But I appreciate you all for coming in and sharing your experience with us, and thank you for what you do for the community and for all the people that you get to help.
Absolutely.
And I look forward to more years of being able to help you.
Absolutely.
Thanks, guys.